Welcome, everyone, to today's episode of the Better Hormone Balance Show. I'm Dr. Natasha Iyer. So, this show is dedicated to all things hormone related. I love hormone balancing. Hormones are the chemistry of life, and balancing hormones keep you youthful and feeling young long term. Last month, on November 25th, 2019, an article was published in Medscape looking at two factors that alter estradiol levels. And I thought that today would be a good day to talk about how alcohol in particular alters estrogen levels in your blood. To explore that further, I have the pleasure of introducing our Director of Medical Education, Dr. Shabnam Das Kar, to you all. She's a functional medicine consultant at Better, and her role at the clinic is research and protocols. It's through this daily reading of everything interesting that comes out in our field of functional medicine and hormone balancing that Dr. Carr pointed me to this article that came out. And I thought, wow, it's holiday season, party time, Christmas is just a week away. Why don't we talk about this so that all of you know how to stay healthier and happier with your hormone balance through the holidays? So Dr. Carr, what did you think of this little review?
Okay, so thank you, Natasha. That was such a wonderful introduction, and welcome to our show. So before Dr. Iyer and I move ahead with what we're going to discuss today, full disclosure, both of us love red wine. So it's not like two sanctimonious doctors telling you what not to do.
Well, and I will say that clearly when patients come to me and I say to them, please don't think I'm going to judge you. I have a love affair with red wine.
I know. So what we are talking about now, estradiol is one of the estrogens that our body makes, and there are three different types of estrogens, but estradiol, and just for clarity, I think you and I will just say estrogens because it makes it easier. Estradiol is the most powerful estrogen in the body. So this paper, which was presented at the recent North American Menopause Society conference, it looks at whether smoking and alcohol impact estrogen levels in the body. So they looked at women who were on hormone therapy. There were two different studies, and I will post all the details on the show notes. So don't worry if you're wondering what paper, what notes she's talking about. So what did they look at? Now these women were the interesting thing is the type of estrogen that they were on, and we have talked about that on a video, so I'm not going to go into the details yet. But smoking, we know that smoking reduces your levels of estrogens in the body. So obviously, smoking, you all know that smoking is not good. But what about alcohol use, and how much is healthy and how much is not healthy for women? Those are difficult to answer, but then there are some guidelines. I will post that as well. So what they found on this is alcohol use increased levels of estrogen in the body, and higher estrogen, again, there's a difference between high estrogen and optimal levels of estrogen. So Dr. R, would you like to say something about the estrogen and what impact higher levels would have on your metabolism and weight gain and all of that?
Yes, thank you. So I'm just making notes as you're speaking about topics I want to circle back to. So that's great. Thank you for that. When it comes to balancing hormones, I absolutely believe in optimal. And one thing I want to point out, though, is that what's optimal for you, Shabnam, is not the same as what level is going to be optimal for me. When we practice in precision medicine, we want to balance all hormones in relation to each other and for that particular individual. And I don't want to actually call it a set point, but what I've seen in all these years of balancing hormones with people is that trying to get to the 50th percentile for one person, someone else might feel great on the 40th percentile or the 30th percentile for that particular hormone level. So it's all about how that person feels and how it is in balance with progesterone and all the other hormones that we treat, like testosterone, cortisol, thyroid, insulin, and all these things impact each other. So I don't know if that's what you're wanting me to mention. But then the other thing about high versus optimal, I'm just seeing a flurry of patients coming in from some source where their doctor's no longer available. And yesterday I saw a lady on 8 milligrams of estrogen. In my
What?
entire 14
Goodness gracious.
years of having this particular practice, I have never once prescribed 8 milligrams. And I have one patient on on 5 milligrams. Everybody else in my practice has a lower prescription. Now, does it mean that someone on 8 milligrams is necessarily overdosed? What if she is a smoker? What if she is on other things that lower her levels based on how her liver processes them, right? So that's one thing to consider. But the more important thing is that 8 milligrams, I think, is absolutely an enormous dose for her. And you can see it because her liver functions abnormal. She's not balanced well. She's got hot flashes on 8 milligrams. And so the natural thing to do is to try and increase the dose, because everyone thinks that hot flashes
Yeah.
have to do with estrogen. So I think that's the point that's very important to make here. When your levels of estrogen are too high in relationship to others, you can have hot flashes. Increasing it will not make you feel better long term. You might get a result for a short period of time, like 2 or 3 weeks. And then after that, you'll start to feel as you did before, because the problem is not estrogen. So when estrogen is too high or too low, you'll get very similar symptoms. Actually, too high, you'll get the weight gain, you'll get the cellulite, you'll get the hip and the thigh fat, and all of those things happening as well. So is that sort of where you wanted to go with the too high?
Yeah, definitely. And just a few more things I wanted to mention. You brought up the liver, and thank you for reminding me, because for Dr. Iyer and me, the liver is like, of course, for all of you, the liver is a very, very important organ. And sometimes we kind of don't think about it as much as we think of the heart and the brain and the bones. So the type of estrogen that you are on, whether it is an oral estrogen or is it a cream, that is very important. So when you're reading about any articles, and this particular one, they had used oral estrogen. So the oral estrogen goes through the liver. So definitely that would have an impact on liver health and all of that. And the other thing is alcohol goes through the liver as well. So both these things, alcohol goes through the liver, oral estrogens go through the liver. Both of these would definitely impact, how you do and your liver health. And along with that, if you have metabolic dysfunction, fatty liver, pre-diabetes, all those things will also impact the liver as well. So just wanted to, bring that up. And yes, what you talked about high doses of, and not just estrogen, any hormones. So the one way of looking at it is, as Dr. Iyer mentioned, someone who has hot flashes at a very high dose of hormones, what would a lot of people do? They would just increase the hormones, right?
So sorry, Shabnam, I'm going to interrupt you. You are an obstetrician gynecologist by trade.
Mm-hmm.
That's what you did in your life before functional medicine. And I was a resident in obstetrics and gynecology, and then I did rural obstetrics and gynecology for 8 years. So it's not like we're unfamiliar with the medical approach to hormones. But I can tell you, I worked in the menopause clinic, it was called. And we used to prescribe Premarin at 0.3 milligrams. And if that didn't give the lady relief, then when she came back for follow-up, we'd go up to 0.625. And then at follow-up again, we'd go to 0.9. And sometimes we'd increase higher. But other than that, we'd say, sorry, it's not working. We'll just, here's your antidepressant, because we know that Effexor, for example, helps you to not have hot flashes, or here's your prescription for clonidine, because there's nothing else we can do for you. And at no point did we ever test levels or look at liver function or anything. Did you do anything different to that when you were practicing?
So Natasha, I'm sorry, I missed last few sentences. I'm having problems with my internet connection. So going back to my background as an OBGY, so I was an OBGY in India, and I have told you many times before, in India, we never recommended menopausal hormone therapy. And I don't think the practice has changed even today. Wow. So we just left women deprived of hormones. And I, now with my knowledge in this field, I feel that is so unfair.
Right.
Yeah, that was the standard of care, because we used to read the same textbooks, that if a lower dose is not making someone feel better, not making the hot flashes go away, then you just keep increasing the dosage. Because back then and even now, we don't always, it's standard of care. We don't look at the hormone levels for estrogen, progesterone, and testosterone, though we don't do that for thyroid, thank God. So here is the point where, Dr. Iyer and my approach to hormone therapy is, we look at not just your blood levels, we look at saliva levels. And that is for a different episode, where, what is the controversy about the testing? Why should it be saliva, dried urine, serum? So one important point, and many of you are familiar with this, if you are using hormones as on the skin as a cream or a gel, blood levels are not the most accurate way to measure. And that is what you have heard. Many of you have worked with Dr. Iyer, Dr. Iyer says, oh, I can't say anything about this if you don't do a saliva test. And sometimes you wondered, you hear saliva tests are not valid, all those things. We talked about all of that on the other video. So yes, just increasing more and more hormone levels, just because your symptoms are not, not taken care of, is not what we recommend. So
So
this
I'm
is
just going to pause. Sorry, Shabnam, I'm just going to pause you there. So for all of my patients listening, or my future patients, please know this: never ever self-adjust your hormones.
Oh, yeah, absolutely.
This is the point we're trying to make. When you're on topical hormone therapy, which we know even with the North American Menopause Society, and before they released that consensus guideline, Shabnam, we've been using topical hormone therapy for years and years because we know it's safer. And I want to circle back to that oral estrogen part. We know that when you take estrogen by mouth, so as a pill, it is more inflammatory and thus related to more side effects like blood clots and other things. So in our practice, we never use oral estrogen, which is an important point for this study, but I still think that the findings are comparable because of my own personal experience with my love affair with red wine and going into, I can feel in my body when I'm estrogen dominant and when I'm not, and it's directly related to my consumption of red wine. I can say that for certain. But back to patients listening, do not adjust your own hormone levels. Do know that what we found from reading the study, or what was found, was that your levels internally of estrogen will rise with increasing alcohol consumption. That being said, no two people are the same, and this is why we love to look at genetics in our practice, right? It's because how you metabolize something is very different to how I would, Shabnam. Isn't that right?
Oh, absolutely.
And then, of course, with the biochemistry and everything else going on and all of our other exposures, how would we know what level you're going to get and what level I'm going to get after 2 glasses of wine? We don't know. What we're saying to you, though, is be aware that alcohol consumption changes your estrogen balance. So that translates into real life as well when we're working with patients, in that and now it's I always ask patients, what's your alcohol consumption? And people always just scribble something, but I don't think they realize why I ask that at every single visit. It's because when we're struggling to get you balanced and we've just adjusted all your dosing and then it works and then it stops working, have we considered all of the factors? Now, alcohol is just one factor, and we're talking about alcohol because it's the season. I mean, goodness, people are going to be consuming alcohol from first thing in the morning when they're having their eggnog with rum, or they're, at lunchtime, they're going to have their Christmas punch and all their lovely drinks. And so alcohol is easy to consume in excess over the holidays because it's so usual to do that. And there's nothing wrong with it if it's for a few days, but if you feel hormonally unbalanced, talk to us first before you run out and adjust your levels that you're using.
Yeah, that's a very important message. And another thing is, again, looking at how can you manage these holidays better. So all of you know what you have on your social calendar. So this is just a suggestion, and not that I have always been able to implement it. So if you know that, you're going to, like, for example, if I know I'm going to meet Dr. Iyer, then I'm going to make sure that I can drink some wonderful wine with her because that's something we both love doing.
Mm-hmm.
Versus, I'm going somewhere else where I don't know whether the wine is going to be a good quality one, or then I'll say, okay, I will choose when I'm going to drink wine, and of course, with whom I'm going to drink wine. So these are just, take a look at your social calendar and decide ahead of time, okay, these are the places where I would probably drink. This is a place where probably I wouldn't drink. And of course, the usual things about driving and all those things, of course, are important. But from a standpoint of hormonal balance and how you can navigate the holiday seasons a little better, because so many times, Natasha, we've met people who said, oh, I've been bad during the holidays. And I feel so bad to hear that, because it's nothing like bad or good. It's all of us are humans, right? So just to have a few strategies in place, and maybe ahead of time, if you can plan, number one is don't drink on an empty stomach. Of course, that all of you know that.
Rule number one, yes. And I think everybody knows it hits you harder and faster.
Yeah.
I say to patients, make sure you enjoy it. So don't drink just for the sake of drinking or to be social. Try to not worry about what other people think. And I've seen this, you go to someone's house or you're having a party and they're like, have more wine. And in restaurants, I think you've seen me do this. I put my hand over the glass. I do not allow them to top up without me finishing what I had first.
Yeah.
So I make sure to know in my head how many servings I'm going to have. And I don't always stick to it. I have to be honest. Like, I've taken an Uber home more than once just because I've had that second glass when I didn't plan to.
Oh, yeah. Me
Right.
too.
And
I know.
so, yes, even the best laid plans can go awry. However, it's, let's plan it. Let's maybe fast for the morning and skip breakfast. Let's eat lunch with protein and fat. Let's never go to a party or an event on an empty stomach. Eat something at home because you don't know what they're going to have there. Plan how many drinks you are going to allow yourself and try to stick to that. What I've started doing is having a glass of soda water with lime. It looks like a drink, and I notice nobody asks me if I want more alcohol. And
Oh,
if
really?
I'm at a party and they're coming around serving more and they see that glass in my hand, they don't stop and ask me if I want some, which is great. And Shabnam, I've noticed not only do I get estrogen dominant when I have wine like 2-3 days in a row, but my belly fat, like, it just shows up as belly fat. And there's not enough calories. I've heard patients say that, wine is not so high in carbs. It doesn't have so many calories. And this is a Michal offer talk. I'm not even going to try and get into it. But that explanation that she gives of oxidative priority makes sense to me, and I see it physically. So, other than for managing your estrogen safely, just think belly fat when you're trying to manage how many drinks. So the little tricks I do, I have nuts in my purse. I eat nuts before I go anywhere. I try to eat a small meal before I go anywhere, so I'm not forced to eat badly when I'm there. I know I'm going to enjoy alcohol, or I know I'm not going to enjoy alcohol that day, and that's a choice I make prior to getting to where I'm going. And I think everybody knows I'm really social. Sometimes in a week, I'm out 4 or 5 times in a week. And I don't necessarily have alcohol at every single event. So I'm not being pious here at all. I'm not trying to be better than. I just don't want to have the other complexities to deal with, including when estrogen is high, I have very poor liver metabolism of everything. So I want to circle back to the gut and the liver for hormone balancing. We're saying that alcohol raises estrogen levels, especially for our menopausal patients who are on estrogen. That makes sense. Our perimenopausal and premenopausal patients should be aware that when they're starting to not feel great, when they start feeling like their progesterone levels are low, it might be because we've raised the estrogen levels. And what I'm talking about here is that balance between estrogen and progesterone. So I'm taking this slightly away from the article, Shabnam, if that's okay, just because I think every woman has estrogen or will have estrogen levels to some degree. And we need to know that all of you are going to be affected by the daily habits and things that you're doing. one other hint I have for patients is estrogen is not only processed by the liver, but it's excreted. The negative metabolites of estrogen are excreted in the gut. So your first thing to do over the holiday season is to make sure you're pooping well every day. Take your probiotics, increase your water intake, increase your magnesium and your vitamin C and all the other things that we talked to you about for gut function, because if you're constipated, you're also recirculating estrogen metabolites.
Yeah.
And we don't want that to add to everything, because when you're talking about high versus optimal levels of estrogen, no one wants to be high, not just for the weight gain and the cellulite and the estrogen dominance and all the mood symptoms and everything that come up with that, but high estrogen and not knowing how it metabolizes in your body is definitely increasing your risk for breast cancer.
Oh, yeah, absolutely. So just about that, the alcohol and weight loss part that Dr. Iyer mentioned about oxidation priority. So what basically in simple terms is uh, our bodies are not designed to store alcohol. So when we drink and eat food at the same time, the body has to metabolize the alcohol first. So alcohol gets a higher priority in terms of metabolizing it. So alcohol gets metabolized first, and then if you have eaten, let us say, some carbohydrates with that, then would come the carbohydrates and all of that. So sometimes higher alcohol consumption would get in your way, even if you're eating similar food, because of the way the body prioritizes and how it metabolizes. Another important thing that I wanted to bring up is a lot of people talk about hormones helping in weight loss. So the message that Dr. R and I would like to give you is, adding hormones to whatever else you're doing will definitely help you. But if you think that in the perimenopausal age or after menopause, all you need to do is slather some hormones on your skin and take some oral progesterone, and don't bother with the rest of your lifestyle. Like, you don't bother with the food, with the alcohol intake, with the toxins or any of the other things, and you're going to lose weight, that is not going to work. So just two things. Yes, alcohol impacts your estrogen levels in the body. It would also impact hormone balance because of that. And it can impact weight loss. These are the two big things that, and hormones alone will not solve all your problems. It's one piece of the puzzle. It has to work in relation to everything else that's going on.
Thank you, Dr. Carr. Now, before we wrap up, there's just one thing I wanted to bring up, and it's not specifically about estrogen and alcohol, but it's that statement that they made in the paper, in the summary review, where they were talking about estrogen and atherosclerosis. Now, atherosclerosis is blood vessel disease and where we're making plaque, right? And so it translates into heart disease. Well, we can have disease in other blood vessels elsewhere, like the brain, but we'll stick to the heart. And it says here, to achieve serum estradiol levels desirable for the prevention of atherosclerosis, factors that affect serum estradiol levels, such as BMI, smoking, and alcohol, should be considered in individual women. So I'm just reading that one little snippet. And the reason I'm doing that is I want you to comment on estrogen and heart disease, please.
Okay, thank you. So we Dr. R gets a lot of people who are, they come to her asking for hormones, and then the cardiologist says, oh, hormones are probably going to be harmful for you. So what is the truth? And we have talked.
Sorry. But cardiologists have said to my patients, you should not be on hormones because it's going to increase your risk for heart disease. You already have high risk, and so you need to stop your hormones. So please comment on cardiologists saying that to patients.
Okay. So yes, they are right in a way, because it depends on what type of hormone therapy you're on. As Dr. Iyer has mentioned before, if you are taking oral estrogens, now progesterone is a different story, and we talked about it.
Story for a different day. Yep.
Yeah, for a different day. So if you are taking oral estrogens, even if it is bioidentical, and we've talked about bioidentical before, so even if it is bioidentical, it would go through the liver, and and oral estrogens increase clotting. So the cardiologist is right in the sense that if it is oral estrogens he or she is talking about, yes, that is not what we would recommend. But estrogens applied to the skin, they are not going to increase your risk for clotting. They are not going to make you, have a heart attack. Of course, there are a lot of other factors as well. So yes, it is right and not right in the sense it depends on what form of hormone therapy you are on. So progesterone, again, we talked about it on the other video, and I'll post a link to that as well. So it is, the devil is in the details actually. So but at the same time, women who have lower hormones are at a much higher risk for heart disease, dementia, and metabolic dysfunction and everything. So it has to be tailored to you, and it has to be tailored not just to your physical body and your genetics and all that. It also has to be tailored to your lifestyle, to your individuality, and that is what Dr. Iyer and I are so excited about. Okay.
So I just want you to say it in one sentence. Is estrogen important for heart disease risk reduction?
Yes, but it will, all the caveats of what are you using it and how much. As Dr. Iyer mentioned, high doses will not be the best thing, but having low estrogens postmenopausally, how long after menopause, all those factors are extremely important. So low estrogen is not a great idea for if you want to prevent heart disease and stroke.
Thank you, because there's enough data now and science available to support that statement. And I'm sorry I'm making you say it over and over again, because I just want our listeners to know for certain that managing your estrogen levels is not detrimental to your health, provided, yes, that we look after the metabolism, we optimize the levels, and we stick to transdermal rather than oral.
Yeah. Okay.
All right. So I think I thought we were going to just spend 5 minutes saying, hey, ladies, or everybody listening, yes, estrogen, yes, alcohol raises your levels, and how to make it through the holidays, lowering your alcohol consumption, or all the things that you can do. I think I'd give you one last bit of advice, other than also, like managing your bowel movements and looking after your liver health. I think, and personally, I do this every day. I take something to support how my liver processes out all sorts of things. And I don't have time to talk about, the cytochrome enzymes and the genetics of detoxification and all of that. However, I recommend liver support, especially through periods like this. What do you think of that?
Oh yeah, and what Dr. R means is, supporting your liver by the use of nutrients, and it would be a combination of food and supplements. So liver is a major organ of detoxification, and a lot of nutrients are required in the detoxification process. So yes, if you know that you're going to make your liver work harder, it makes sense.
I'm making it work harder this week. I'm meeting you tonight, remember?
Oh yeah.
And then I'm leaving. I'm leaving to see family after that. It's going to work really hard. So just quickly, what are some of the important nutrients, Dr. Carr?
The important ones would be the B vitamins, then the curcumin, then broccoli extracts, then NAC, and we have a lot of stuff which they come in combination of all of these together. And of course,
so I'm taking Cell Deep Clean right now because it has a little bit of everything in it. And then I take my B vitamins separately. But the brassica vegetables, you said food. And we know that all of the brassicas, like Brussels sprouts, broccoli, cabbage, kale, broccoli sprouts, all these things, what do they have, and why does it help support the liver and estrogen balance if we're looking to add food to help us have better estrogen levels while we're drinking alcohol over the holidays? Because we're going to do it anyway.
Yeah, so food and the plant chemicals that most of these contain are things called glucosinolates or sulforaphanes, and I'm not going into the big words. But just one point I want to highlight is they did a few years ago, they did a study on, so they looked at the levels of these beneficial plant chemicals in broccoli, and from the outside, all the broccoli looked alike. But when they actually measured the levels of these, they found that it varied. And of course, we know that it would vary depending on the soil and depending on how long ago you plucked it. So the point I'm making is, yes, you do need food, but if you are going to rely on food only to balance your hormones, that is not going to work, because you don't know how much, uh, of these beneficial stuff you're getting from the broccoli that you've eaten, here, versus, relying on food as well as supplementation. And again, some of you may need more if you're going to make your liver work more. I don't think you're going to get that from, eating only broccoli.
Well, I can tell you something for certain. I do eat lots of broccoli and Brussels sprouts. I'm, in fact, eating so much, I think I'm going to look like a broccoli and Brussels sprout soon. However, I do not ever count on my food. I just wanted to address that they have valuable compounds that help you with healthy estrogen metabolism and balance, because you can just add these little things to help you even further. So I would recommend, if you're going to have a blast this holiday and say, I don't care what I do and how I do it, I'm not interested in managing how many drinks I have, I'm just going to do it, fine. Take a cell deep clean, take a little bit of extra liver support, and make sure to eat more of these things that are helpful for you, and then increase your good fat intake so that you don't end up overly consuming. Because I find fat is very satiating, and I like that, because then I just don't want to consume more things than I should.
Okay, yes, that makes absolute sense.
So hopefully this was helpful to all of you. Feel free to post your comments and let us know what topics you want us to cover. Dr. Carr will be really good about sharing the links as she mentioned and adding the extra information below. And we look forward to providing you with regular education updates and advice on how to just live a more balanced life, and at the same time how to achieve better hormone balance, because you don't balance hormones by simply taking hormones.
Thank you, and bye now. Happy holidays to everybody.
Thanks, Dr. Carr. Bye-bye.
Bye.